Southern California remains at 0% ICU capacity. Governor Newsom is expected to extend the stay-at-home order later today. And joining us now is San Diego County Supervisor Nathan Fletcher. Good morning to you, Supervisor Fletcher. How are you doing?
Good morning. Good morning. How are you?
I'm well, thank you so much. Now, how much longer would you expect the governor to extend the order? Because we were expecting for it to end yesterday, but obviously that's not going to be the case.
Well, the simple reality is we're still in the throes of it. Our cases might have plateaued, but they certainly haven't come down. Our hospitalizations continue to significantly increase. And given the really dire state of our hospital and medical system in San Diego County, I think COVID really still remains to be a kind of wildfire burning out of control, not a brush fire that's been knocked back by a little bit of effort. And so I think we're going to be in it for a little bit. And I still think that the worst is yet to come because of the delayed effect. Even if people did better at Christmas than we did at Thanksgiving, it takes many weeks for that success to show itself.
And you bring up a good point. That delay, of course, we're not quite out of the woods yet in terms of that holiday surge that you were warning about, because we still have New Year's just right around the corner.
That's right.
Okay.
No, it is. And, when we took an increasing case count, cases were increasing as we headed into Thanksgiving. And then Thanksgiving was just a complete disaster in terms of the spread. More people get it. Everyone gathers for long indoor periods of time. All of those people then get it. Then they go back out into their day-to-day lives. And the simple reality is we're just seeing a lot less willingness to follow the public health orders. Some of it is elected officials that encourage people to openly defy them. The conspiracy theorist mindset and misinformation is really taking hold and taking off. And so it's made it much more challenging and a much more difficult situation. And it's very hard because when you see what's happening to our hospital system, when you hear from the doctors and the nurses and the healthcare providers, when you have the federal government that's now injecting billions and billions of dollars in to help our small businesses that are being impacted, this ought to be a moment we ought to be able to rally together as a community and say, look, we're gonna do everything we can to slow the spread, but we continue to fight, tremendous resistance to what we're doing, and that only prolongs the amount of time we're going to be in it.
You mentioned the hospitals, and we had read this morning that our local morgues were being inundated right now. What is the county doing to help hospitals or morgues that may be overworked right now?
Well, the county went in preparation. Hopefully, we were really hoping we would never need them. But we went and invested in additional refrigeration trucks where you can store bodies. In the early days of the pandemic, you saw these really awful settings coming out of places like Italy and Detroit and even New York. And so we wanted to be prepared for every contingency. This was one we really, wanted to be prepared for, but hoped we'd never have to use. And that is the utilization of excess morgue capacity, just for the significant increase in the number of people that are dying from COVID. And, we continue to hear repeated all the time, oh, it's not bad, there's no harm, you're going to be fine. And then we look at, now the incredibly large number of San Diego families whose loved ones are forever gone. And there's a lot of things that you can rebuild as you come back, but you can't rebuild a life. And it's also important to note it's not just those with COVID that are being impacted. Because of the strain on our healthcare system, a lot of procedures are being denied or delayed, including tumor removal for cancer patients. And those to make space for COVID patients. So this really is getting to the place where it's impacting a lot of folks.
Okay, so we're talking a little bit about, the extended stay-at-home order that is expected to come down later today. What about, when you think about the local level in terms of businesses, I think about some of our local restaurants and just our mom and pop shops. What can be done to help those who are barely hanging on as is?
Yeah, well, there's a couple things. I mean, at the county, my office led the effort to provide tens of millions, more than $100 million, I believe, in economic assistance to businesses that have been impacted. We also are prepared to announce a new state program. We're looking at about, I think, $500 million, again, grants, assistance to help people through these difficult periods of time. And then the federal government finally passed something, and people can debate and quibble about it. Should have been more, it should have been less. But look, it is a significant amount of money that will go out to businesses to help get them through, along with increases to the unemployment insurance for folks who are unemployed. And, we had that help early in the pandemic, and I think it was much easier for a lot of folks to say, okay, look, let's do the right thing because we're going to be made whole, we're going to be okay, or we're going to, be able to survive, maybe not made whole. And my hope is with the federal assistance and everything the state's doing, we can get back to that point. But it really took the federal government a long time to provide that help and assistance. And I've always thought if a business has to close because of a public health order, there ought to be resources available to them. And we've done everything we can at the county to provide what we can. And I'm glad the federal government finally stepped in to provide another avenue of assistance for these businesses that are having a hard time, and they didn't do anything wrong. It's not their fault.
Okay, before I let you go, let me just put it, I just want to break it down. The way people are talking about, people are beat down right now. They're scared.
Yeah.
There's a lot of hopelessness that people are feeling. 2021 is just around the corner. What do you have to say, Supervisor Fletcher, for the people who are just, they need something. They need something to hold on to.
Yeah. Well, look, this has been hard. I know it. This is a thing that happens once every 100 years, and it's happening at a really difficult time. We're very divided, but there is still a lot of good that is out there, and I think every day when you choose to get up and say, look, we're in a difficult period, difficult time. The closest I equate it to is being in a combat deployment, which I did several of. It's like every day you're like, I just got to survive today. But the difference here is, like, we have a vaccine that's here. We have hope on the horizon. We are actively in the process of vaccinating healthcare workers, and that vaccine is going to continue to be rolled out to so many. And so we are going to get our life back, and we're going to get it back in a way that is meaningful and impactful. And we've just got to stay in the fight for a little bit longer. We just have to say, look, we're not giving up every New Year's Eve celebration with all of our friends going crazy. For those of you that can stay up past midnight, unlike myself, but we are going to do it one more time, and we're going to do it because we love each other, and because we care about each other, and because we're willing to sacrifice a little bit for each other. And then we're going to rebuild our businesses, and we're going to rebuild our economy, and we're going to catch our kids up because they fell behind from distance learning, and we're going to do all that. But we're an incredibly resilient people, and we can get through a lot. And sometimes when it seems like you can't, you got to take a moment and pause and say, what are the things that I'm truly grateful for? And what are the things that I look towards and say, you know what, this is a really good part of my life, and this is something that is important to me. And it is, it's tough with so much negativity and so much hostility out there. It's so easy to have that dominate what you have. But I took my kids out to an open field to, throw the football, yesterday afternoon in a safe, responsible way. And there was so much joy over a rainbow, and it was just, it was, little kids running around with rainbow, and you're like, all right, you know what? Businesses are hurting, people are dying, our healthcare workers are overtaxed, but we're going to keep fighting to get through this. But there are still a lot of good things. You just have to choose and find a way to go out and find those each day to remind yourself of it.
Absolutely. All right, we're going to keep fighting. Supervisor Fletcher, thank you for your time.
Thank you so much.